Hello, cats and dogs parents. I'm Dr. Cola. The American Animal Hospital Association, AHHA, categorizes pet nutritional assessments into two primary types: screening evaluations and extended evaluations. Screening evaluations in particular are recommended to be conducted during every veterinary visit without exception. These evaluations include BCS, Body Condition Score, BFI, Body Fat Index, MCS, Muscle Condition Score, weight measurements, and limb circumference assessments. However, you may have noticed that during actual visits to the veterinary clinic, these assessments are not always carried out thoroughly by veterinarians or veterinary technicians. Why does this happen? Today, I'm here to provide you with the answer to this question and offer tips on how to make polite and effective requests during your visits. With the right knowledge, you can clearly convey your concerns and requests without causing any misunderstandings, which can make a big difference in ensuring your pet receives the best possible care. First, let me introduce a relevant study. Back in 2018, a survey was conducted in Canada involving 177 veterinarians, veterinary technicians, and veterinary assistants. The survey examined the frequency of body composition assessments, their knowledge of nutritional assessment guidelines, and the methods used for body composition evaluation. Although this study was conducted 7 years ago, I believe it still holds significant relevance today, as it seems that little has changed in this area over time. The key findings were as follows. Among the respondents, 80% stated that they had heard of the nutritional assessment guidelines issued by the American Animal Hospital Association and the World Small Animal Veterinary Association. However, only 25% reported that they actually applied these guidelines in their clinical practice. Of those who implemented the guidelines, fewer than half, 44%, used all three methods: body condition score, muscle condition score, and weight measurement to assess body condition. In terms of frequency, only 66% of the 177 respondents said they always evaluated body composition. The remaining respondents reported doing so frequently, 24%, occasionally, 8%, rarely, 0.6%, or never, 0.6%. The most commonly used screening methods in veterinary clinics today are body condition score and weight measurement. These methods are simple and easy to implement, which likely explains their popularity in clinical practice. Interestingly, however, these methods are also identified as the preferred options when asked which assessment techniques would be used if accuracy and cost were not limiting factors. Even non-experts, such as pet parents, recognize that methods like BIA, bioelectrical impedance analysis, and DEXA, dual energy X-ray absorptiometry, are more accurate than visual assessments like BCS and weight measurement. Despite this, veterinary clinics still regard BCS and weight measurement as the most accurate methods. This discrepancy is not solely due to cost and time constraints, but also reflects a lack of interest or motivation among veterinarians and clinic staff to adopt more advanced body composition assessment methods. What's particularly fascinating is that, according to the survey results, 94% of respondents stated they would adopt a more accurate alternative method if it were available. This indicates that while veterinarians and veterinary professionals may be accustomed to and reliant on simpler methods like BCS and weight measurement, they also express a strong desire for more precise and efficient evaluation techniques. Looking ahead, it will be crucial to address the cost and time limitations associated with alternative methods such as bioelectrical impedance analysis, dual energy X-ray absorptiometry, MRI, CT, and QMR, quantitative magnetic resonance, to make these technologies more accessible in clinical settings. This isn't merely a matter of pointing out a lack of interest or reluctance among veterinarians. It underscores the importance of advancing science and technology to make these advanced assessment methods a practical reality in everyday veterinary practice. For example, developing pet-specific BIA or DXA devices could be a highly practical solution. Current BIA and DXA equipment is primarily designed for humans, often making them unsuitable for pets due to differences in body shape and physiological characteristics. Therefore, creating smaller, more portable, and cost-effective devices tailored to pets could greatly enhance their usability in clinical settings. Furthermore, these technologies hold the potential to be commercialized for use not just in veterinary clinics, but also by pet parents at home. If compact devices specifically designed for pets are developed, pet parents could easily evaluate their pet's body composition at home. Clinics could then utilize advanced methods like DEXA or QMR for additional assessments, ensuring higher accuracy and reliability of the data. Such innovations could significantly improve accessibility and convenience for both veterinarians and pet owners, ultimately advancing the overall standard of pet healthcare. In veterinary clinics today, while body condition score and weight measurements are relatively common practices, body fat index and muscle condition score evaluations are often overlooked. However, this can compromise the precision of the assessment. For instance, in obese pets classified as BCS 8 to 9, BFI provides more accurate and detailed information. Conversely, in underweight pets, combining MCS evaluation with other methods is essential to determine their true condition accurately. In such situations, it's crucial for pet parents to understand the concept behind each evaluation and request the appropriate assessment based on their pet's condition. By combining all these evaluations, the most precise body composition analysis can be achieved. Therefore, when visiting the clinic, make sure to confirm whether each of these components is being assessed for a comprehensive understanding of your pet's health. If you see a measuring tape being used at the clinic, it means the veterinarian is evaluating your pet's body fat index through calculated equations. If the vet is palpating your pet's abdomen and ribs, this indicates they are assessing the body condition score. Similarly, if they are examining your pet's muscles by touch, they are checking the muscle condition. Lastly, weight measurement serves as the foundation for all these evaluations. If the clinic cannot perform all four assessments, it's essential to request the ones most relevant to your pet's condition. For example, if your pet is obese, you can ask, "Could you also check my pet's BFI?" If you suspect your pet is underweight, you can request, "Could you evaluate my pet's muscle condition as well?" If you're curious about their overall body condition, you can inquire, "What is my pet's BCS score?" By making specific and clear requests like these, the clinic is more likely to conduct a thorough and systematic evaluation of your pet's health. If your pet's BFI, BCS, MCS, and weight evaluations have already been conducted at the clinic, it's beneficial to take it one step further by requesting an assessment of their ideal weight, basal metabolic rate, and daily calorie requirements. These calculations are essential for managing your pet's weight and improving their overall health in a more systematic way. The BMR represents the minimum amount of energy your pet needs to maintain vital bodily functions. The daily calorie requirement is then calculated by multiplying the BMR by an activity factor, which varies depending on your pet's exercise level and lifestyle. However, it's important to note that the activity factor can differ based on the perspective of the pet parent and the veterinarian. If the activity factor is inaccurately set, the pace at which your pet reaches their ideal weight may slow down. For example, providing excessive calories to an overweight pet can hinder weight loss progress. Conversely, failing to supply enough calories to an underweight pet can result in difficulty gaining weight and may increase the risk of malnutrition, metabolic disorders, or other health issues. To ensure accurate and effective weight management, discussing and agreeing upon the activity factor with your veterinarian is essential. This helps to create a tailored plan that promotes your pet's health and well-being while minimizing risks. Therefore, I encourage pet parents to use the formulas introduced in Part 3 to calculate your pet's basal metabolic rate and daily calorie requirements on your own. Comparing your results with the values provided by the clinic is an important step in managing your pet's health more systematically. Before your next veterinary visit, don't just stop at checking your pet's BCS, BFI, MCS, and weight. Take the time to calculate their ideal weight, BMR, and daily calorie needs beforehand. Then, compare these numbers with the ones provided by your veterinarian. This proactive approach will help you develop the most appropriate calorie intake plan for your pet. These efforts go beyond simple weight management. They represent the first step toward increasing your pet's average lifespan. By actively understanding your pet's condition and collaborating with your veterinarian, you can make a significant difference in ensuring a healthy and happy life for your furry companion. This has been Dr. Cola. Thank you.